of course, you're taught in school, and they don't even know what EAV is, especially here in the United States. You know, this technology came out in the 1940s. It is not new technology. It's newer in the United States. I started doing it in the early 1990s, so I've been doing it for quite a while. But what I've found is that the dentist is removing a tooth, or they're cleaning out an area of the jaw where a tooth used to be. And it's a really small hole, and it fills with blood pretty quickly. Therefore, the dentist oftentimes can't see. As try as they may, they've got a surgical suction in there, and they're trying to make sure that they can see that they haven't broken a root tip, or that they have all the periodontal ligament removed, which is not something easy to see, or that they just cleaned out all the dead bone. And that's really not easy to see at all. But electricity cannot go through something that's dead. So my findings through the years have been that when we get everything cleaned out, as well as the surgeon thinks the area is cleaned out, then they will touch an area and I will take a reading. We get back to 50 goes in, we want 50 out. Now, if we've cleaned up this area and it's nice, clean, healthy bone, I'm going to get a 50. I'm not going to get a 49. I'm not going to get a 51. I'm going to get a 50 over and over and over again because it is nice and healthy. If I don't, that means that we might have more to remove. It might mean that a little area has wormholed into the bone. It might be that it's gone beyond the sinus membrane, but we don't know until we test it. And when we test it, what we find is we started with an area that was low because it's dead or it's dying and the electricity is having a difficult time getting through. Oftentimes what we find is it scoots up afterwards. And this is my analogy of what happens, is that the tooth has been sitting there suffering for such a long time. Imagine that you're sitting at a railroad crossing and you're late for some important engagement, and the railroad arm finally goes up after you've been sitting there for 10 minutes. You're the first car to go past the railroad arms. Usually what happens is you really put your foot on the gas pedal and you go. And then you autocorrect to the speed limit afterwards. So I think what happens is we have all this pent up energy that has been trying to get past this area, and it just scoots through. Now, if you actually look at Herring's law and how things happen, at one point in time was acute before it was chronic. And when it's an acute issue, we get higher readings. But what we do is flush the area out, and we just bide our time until homeostasis occurs and we're able to get a 50 over and over again. Can you do the surgery without it? I'm certain you can. What happens is that the dentists that get used to finding that there's still an area that needs to be addressed, and they clean that out, they have more certainty in their surgery, and they're nervous to do the surgery without having that added benefit.